All right, welcome to The Explainer. Today we're going to talk about something super important, testosterone blood tests. We're going to cut through all that confusing medical talk and just give you a simple guide, so you can actually understand what's going on with your own body.
So let's just dive right in. Have you ever had those days, or maybe even weeks, where you just feel off? You're tired, maybe a little moody, and just not yourself? It's a really common feeling, and believe it or not, a simple test could be the key to figuring out what's actually happening.
And it all comes down to a hormone that is, well, super important for how we feel every single day, but honestly, it's one that gets misunderstood a lot.
Okay, so first things first, let's bust a huge myth right now. A lot of people hear testosterone and immediately think it's just a guy thing. But nope, not at all. It is a vital building block for everybody. We're talking mood, energy, muscle strength, you name it. It's crucial for both men and women.
Okay, so if this hormone is so important, how in the world do you know if something's out of whack? Well, the good news is your body is actually pretty great at sending out signals. You just have to know what you're listening for. And what's really interesting when you look at this is just how different the signs can be. For guys, it might show up as low energy or, a drop in libido. For women, it could be something totally different, like irregular cycles or unexpected weight gain. But check this out. See the overlap? That persistent fatigue, the mood swings, those are things that can hit anyone, and they often point back to the same hormonal root cause.
And then there's a big one we just can't skip over: age. The reality is, for most of us, testosterone levels naturally start to dip once we hit our 40s. That's exactly why paying attention to this becomes a really key part of, being proactive about your health.
So if you're sitting there nodding along, thinking, hey, some of this sounds familiar, your next thought is probably, okay, so what do I do about it? And the good news is, the path to getting some real clarity is way more straightforward than you might think.
I mean, it really is this simple. Step 1, you just chat with your doctor about your symptoms. Then, step 2, you'll probably have to fast for a bit, maybe 8 to 12 hours. That's just to make sure nothing you ate messes with the results. And finally, step 3 is just a quick, simple blood draw. Seriously, that's it. That's all it takes to get the actual data.
All right, so once that sample is off to the lab, we get to the most important part of this whole thing: figuring out what those numbers on the page actually mean for your health.
So what your doctor does is they take your results and compare them against what's considered a normal range. You can see here for men, that's a pretty wide range, like 270 to 1070. For women, it's much lower, usually somewhere between 15 and 70. And that NG/DL you see, that's just nanograms per deciliter. It's just the sciencey way of measuring how much is in your blood. But here's the really crucial part. Normal isn't a one-size-fits-all thing. Your doctor is going to look at these numbers in the context of you, your age, your health, the whole picture.
So, of course, the big question is, what happens if your number is outside that range, right? What does that even mean? Well, this is where the test stops being just a number and starts being a really powerful tool for you to take charge of your health.
The best way to think about an abnormal result is not as a scary final diagnosis, but more like a really important clue. It's a signpost. For example, if levels are low, it might point towards something called hypogonadism, which is just a fancy word for your body not making enough of the hormone. Or in women, if levels are high, it could be a clue related to PCOS. See? The result isn't the answer. It's what gives your doctor a clear map for where to look next.
And this is so important to understand. Getting your results back isn't the end of the conversation, not even close. It's the starting line. It's the beginning of creating a health plan that is 100% built for you.
So what's the real payoff of knowing your levels? Well, for one, you get to act early. You get armed with actual knowledge about your own body, and that lets you and your doctor come up with smarter, personalized strategies. It's all about making informed choices now so you can potentially head off bigger problems down the road.
And this is the magic right here. This is where information turns into action. That number on a piece of paper, it's not just data. It becomes the blueprint your doctor uses to build a plan just for you. And that plan could be anything from lifestyle changes to therapy or other treatments. So let's wrap this up with a final thought. Taking this simple, proactive step, it's really not about a number on a lab report. It's about getting clarity. It's about finding the clarity you need to maybe get your energy back, get your mood back, to feel like yourself again. So the real question I'll leave you with is, what could that kind of clarity unlock for you?